So the great thing about the Men's Hub is that I'm coming across conditions that I may not necessarily have known were even possible. So today is one talking about understanding and managing priapism. So what is priapism? It's a prolonged and often painful erection that lasts more than 4 hours and occurs without sexual arousal. Who thought that was even possible? It sounds like a dream come true. However, it's a medical emergency and it requires prompt attention to review long-term complications such as erectile dysfunction or tissue damage. So there's two main types of priapism. There's the ischemic priapism, which is low flow, and it's the most common type. It's caused by the blood being trapped in the penis and it's unable to drain. It's painful and it requires urgent treatment, and the rationale there is because it's not getting the oxygenated blood into the penis, which is important to stop the cells from dying. You certainly don't want your dick falling off. There's the non-ischemic priapism, which is high flow, and that's less common and it's usually painless. It's caused by unregulated blood flow into the penis and it's often due to trauma or injury. Now the causes, generally speaking, are going to be blood disorders such as sickle cell anemia or leukemia. It can be due to medications such as erectile dysfunction drugs, antidepressants or blood thinners, and it can also be to do with recreational drugs or alcohol use, spinal cord or genital trauma. The non-ischemic priapism is generally due to trauma to the genital area or the perianal area, and there can also be an abnormal connection between an artery and vein, and this is called arteriovenous fistula. Now the symptoms, as we mentioned, are a persistent erection lasting more than 4 hours. There can quite often be pain in the penis and the rigid shaft with a soft gland. So this is that the main part of your penis is going to be hard, but the actual top of the head of the penis is going to be soft. It can be a painless erection after trauma in the non-ischemic priapism. Now when it comes to treatment, first of all, you're going to have a needle used to drain the trapped blood from the penis. So this is called aspiration. You may be given alpha agonists. So this is phenylephrine, which is injected into the penis to constrict blood vessels and reduce blood flow to the penis. And you might, in severe cases, be given a shunt as a surgical procedure to redirect blood flow. Now, non-ischemic priapism often revolves on its own. Ice packs, compression can all help reduce the swelling. Surgery or embolism may be needed to correct blood vessel damage if the symptoms persist. Now, whilst priapism is a medical emergency, complementary approaches can help with the vascular health. So here we would consider herbs such as ginkgobiloba, which supports blood circulation and may help reduce the risk of blood pooling. There's a research paper in the Human Psychopharmacology that highlights its ability to enhance blood flow and improve vascular function, making it beneficial for this blood-related condition. Garlic is a natural blood thinner and it improves vascular health, and it can demonstrate its role in reducing blood pressure and improving endothelial function in and around the penis, and it also helps support healthy circulation. Turmeric is an anti-inflammatory, so it will be helpful in non-ischemic cases of priapism, and it will help address oxidative stress and help aid in recovery of the vascular health. Now, when it comes to tips for prevention, ensure proper treatment for conditions like sickle cell anemia or leukemia. Review your medicines. Speak with your doctor if you suspect a medicine is contributing to it. Avoid risky behaviours. Limit recreational drug use and alcohol consumption, and stay informed so that you're aware of any risks associated with certain medications or treatments for erectile dysfunction. Now, if your erection is lasting for longer than 4 hours, severe pain is a symptom, and if you have recurrent episodes of this, even if they resolve on their own, then it's something that you do want to go and seek further medical attention. That's it for now. Hopefully you enjoyed finding out a little bit more about priapism, and I'll see you on the next episode.